Diagnosis of alcoholic liver disease. Introduction. Alcoholic liver disease, ALD, is a spectrum of conditions that include alcoholic fatty liver disease, alcoholic hepatitis, and chronic ALD. The diagnosis of ALD is based on accurate patient history and detailed physical examination. Concurrent with the physical examination, objective data from laboratory, imaging, and histologic studies are found to help confirm the diagnosis of ALD. Also, novel biomarkers, scoring systems, and imaging modalities can improve the ability to diagnose and manage ALD. Symptoms and physical examination. ALD is generally an asymptomatic condition. The typical symptoms associated with ALD diagnosis are jaundice, malaise, fatigue, anorexia, hepatomegaly, sarcopenia, and fever. But at times, non-hepatic symptoms can also aid in the diagnosis, such as numbness, peripheral neuropathy, dyspnea or fatigue, cardiomyopathy, weight loss and diarrhea, pancreatic insufficiency, and psychiatric or neurologic dysfunction. Diagnostic findings. Although an asymptomatic condition, general biochemical abnormalities in ALD are similar to cirrhosis that are often compounded by chronic alcoholism caused by bone marrow suppression and hypoalbuminemia. For example, as the severity of amyotrophic lateral sclerosis (ALS) increases, the levels of bilirubin increase, while the gamma-glutamyl transferase (GGT) decreases in the blood. Also, non-invasive steps such as the fibro test, which uses alpha-2 macroglobulin, haptoglobin (GGT), a polypoprotein (A1), and total bilirubin corrected for age and sex, seem useful in evaluating advanced fibrosis in ALD. Similarly, the diagnosis of ALD can also be supported by imaging studies. However, hepatic imaging may only help identify the general presence and degree of liver disease and does not prove or disprove alcohol as the etiologic mechanism. ALD can be supported by the findings of ultrasound, CT, or MRI. A recent meta-analysis, including patients with ALD, showed that ultrasound had 85% sensitivity, 94% specificity, positive LR of 13, and negative LR of 0.16 for steatosis. MRI had the highest specificity up to 97.4% and similar sensitivity compared with other imaging modalities. Liver biopsy. In some cases, liver biopsy is considered to provide an accurate assessment of ALD based on clinical assessment alone, such as uncertainty about the diagnosis of ALD, either via an incomplete or inconsistent history or equivocal laboratory or imaging findings. Concern about a coexisting liver injury, which may occur in 20% of patients with ALD. To confirm a diagnosis or assess the severity of ALD before starting treatment, particularly corticosteroids.